Hello, everyone, and welcome to Deeply Simple YouTube. If you're watching it on the YouTube channel or podcast, if you're hearing this, my name is Vidushi Sandhir, and here we break down deep concepts around wellness into simple and easy to understand concepts. And this is the second in a series of conversational podcasts where I have people who have exhibited wellness or experts in certain fields drop in and have a conversation on a specific topic. Now, today's topic is going to be self harm and suicide. So, if these topics are triggering for you, we would strongly advise that you have your support system in case you do decide to listen or watch this podcast. To talk about this topic today, I have Parul Kathuria with me. I went to school in India with Parul. I think all grades. I'm not even sure, but we didn't interact at that time as we were not taking the same classes. But then I came across her Instagram, of all things, social media, and noticed that her page had well rounded posts on wellness, and that really piqued my interest. So we reconnected and we found that we had a lot in common wellness, wine, among other things. She has a very powerful personal story and an important voice that I wanted to bring on the podcast. So I'm very excited. Welcome, Parul. Great to have you here on the Deeply Simple podcast.
Oh, thank you for having me, Vidushi.
So, if you had to introduce yourself to somebody, what would that sound like?
Introductions are always hard, right? So, by profession, I am a mental health therapist. As Vidushi said already, I come from India. I was born and raised in Delhi. And in 2014, I came to Canada and I completed my master's in clinical social work in here, and I've been practicing as a mental health therapist for almost 5 years now. So that's about me.
I think it's really important, but it's also really difficult to be a mental health therapist. So, what led you to this work?
So that comes with a story now, I guess. So my story is tied to my work, to my personal story. So I lost my dad when I was 15 years old to suicide. And that's kind of what intrigued my interest in mental health, because I just can never imagine at that time that somebody with mental health concerns could take their lives. So after experiencing that in my personal life, I was more curious about it, and I myself went through that pain. So I wanted to help other people to move through this pain and maybe prevent some of the pain that I went through as well. So that was something that led me to mental health field.
Thank you for sharing that. I know that it's not easy to share such a personal story so vulnerably. So we really appreciate you trusting this podcast and the people who might be listening and watching to share that story. And if you would allow me to dig a little deeper or dive a little deeper into your story, Parul, what were the mental health issues that your dad was facing? How old were you at that time when this happened?
Thank you for asking that, and thank you for just letting me share my story over here. So the things that my dad went through was a lot. So the initial symptoms started when I was 5 years old. When I was 5 years old, around 5 or 6, I would say, I saw him completely crazy, out of reality kind of thing. So now if I have to put that in clinical terms, it would be a psychotic episode that he was going through. But at that time, as a 5 or 6 year old, I was like, my dad is crazy and something is happening to him. Please save him. And this happened over the span of 10 years. And the symptoms kept on changing from psychotic episodes to really deep depression to manic episodes to suicidal attempts many times in the last couple years before he died by suicide. So he died on April 21st, 2003. So I would say in about 2001, or maybe even about 2000. So around that time, he was actively thinking about suicide, and he was taking steps to take his life.
That is really hard for a child.
Mm-hmm.
And you were in school at that time. Was there anybody that you were able to
Mm-hmm.
talk about this in school or even outside in any kind of support network?
No, Vidushi. At that time, uh, I just pushed everything right inside myself, just put a strong face on, and moved on with my life. And I did not have anybody to talk about these things because I feel that there is a big stigma and shame that is associated with mental health and especially suicide. When it comes to suicide, nobody wants to talk about it, everybody wants to push it away. Um, so I was kind of scared at that time that either people will judge me or people will judge my parents. Um, I was just feeling very ashamed. And also bringing the guilt that we cannot save him, we cannot do anything to save him, right? So those were things that I felt during that time of that people will not understand, people will judge me, people will not accept me. That yes, I come from a broken family then. That
Hmm.
I come from a family that is not okay.
Right. And I think this ties back to just an incomplete understanding of mental health and even suicide, especially at that time. We are talking about
Mm-hmm.
more than a decade back. It's hard to grow up in that time and having to deal with this. And now when you look back at that little Parul who was going through all that, how would you have liked to be supported in that time?
Yeah, that's a great question, Luigi. I think that I would have liked to have an adult in my life who could support me through that grief and helped me to just process my grief in a way that could help me to just make sense of what just happened
Mm-hmm.
rather than turning it into like feelings of guilt and feelings of shame. I would have wanted a counseling support, a person who could really understand what I was going through in those moments, a stronger, kinder, and a wiser person in my life. It could be anybody, it could be a teacher, it could be a
Mm.
counselor, like just anybody in that moment who could just held my hand just in that moment, right? And the process of counseling, yes, of course, that could have come later, but in that moment, just having a stronger, wiser adult who could just like held me and just said that, yeah, I understand you, I see you, that this is hard what you're going through and it's not easy and I'm here for you.
Wow. So when I'm listening to this, I almost see you living two different realities at that time. There are two different versions of you. One is the version in school, who to someone who does not
Mm-hmm.
know what's happening in your life is just a regular kid. And then the moment
Mm-hmm.
you go back home, there is this child who is stepping into almost like stepping into the shoes of an adult too soon. You know, a childhood
Mm-hmm.
that's being lost in bits and pieces a little too soon. It's completely different
Mm-hmm.
realities, is what I'm hearing. That's like crushing my heart as I'm saying that.
Mm-hmm.
Every time you open up about this, I just realize how strong you are.
Oh, thank you, Adoshi. I appreciate. It just came through my heart that these people go through a lot, and having experienced these things through my own life, I think that that kind of just one thing after the other just kind of brought me where to where I am today.
Yeah, this seems like it seems like the path in whatever way kind of chose you as well as much as you chose the path. Um,
Yeah, I work two jobs now, to be very honest with you. But I started with children and youth, and now I work with young adults and older adults. So my main focus is suicide, and I work with a lot of clients who um, have thoughts of suicide or who have been through a lot of trauma, like abuse. So I work with trauma and suicide a lot.
When we talk about suicide, are there any terminology, taxonomy, things that we need to keep in mind?
Yeah, totally. So, and you are referencing somebody who has died by suicide. So you can say that that person has died by suicide rather than committing suicide, or they are successful with suicide or unsuccessful with suicide, or words like that. And then also the other phrases that they ended their life with suicide or by suicide. In mental health, I think overall we really want to move away from associating the person with the illness. So, for example, saying that he is depressed or he's anxious. So he is not anxious. He's not like he's dealing with anxiety, right? The problem is different from the person. So we are actually trying to kind of separate both of them, that they are not one people. Like, yeah.
That is very interesting. So, if in terms of suicide, it would be somebody who's having suicidal thoughts versus this person is
Right.
suicidal. Is that?
Totally. Totally.
Oh, got it. That makes a lot of
Totally.
sense to me because you're kind of tagging and labeling them. But it's kind of like, that this is who you are. This is whenever I talk about you, I talk about this part of your personality versus that you were having this
Mm-hmm.
on this thought on a transitory basis. That's very, I didn't know that. This is very helpful.
Yeah, and again, like Vidushi, thoughts and feelings, they are changing every day.
Hmm.
They are not you, right? Like they are changing, they are constantly changing. So we are always trying to differentiate between the person and their thoughts and their feelings. So they're not associated. They are a part of them, as you said, but they are not them. Right.
What are some signs of someone who is at risk of maybe attempting suicide?
There's no there's no clear cut, like no clear cut manual, but there are some signs that people can see if there are changes in their behaviors. For example, they are withdrawing, they're isolating. There are signs like physically you are seeing that they're not eating, they are losing weight. There are self-harm signs that you can see, and they are writing notes, they are telling people around them, their family members or their friends, that I might not be like living for a long time. You can see that they are there's a lot of like self talk around, I hate myself, I don't like myself, or things like that, right? The energy levels are really low. They are having panic attacks, maybe, right? So those are kind of like the initial deteriorating symptoms and signs that you can look for. There are signs that the loved ones can definitely catch in the initial phases, but if a person has made their mind, you cannot deter that person, and that's really sad.
Yeah, that's really, and that must be really hard as a therapist as well, especially if somebody is coming in and not kind of sharing it. But for those, what I'm hearing is that at any point of time, if there are signs where the behavior is different from what we know the person to exhibit, then it's a good
Yeah.
idea to intervene and kind of get help. If there are changes in patterns and behaviors and eating
Yeah.
habits, sleeping patterns, get help. And
Absolutely. And I feel like many people do fear even and of course, like mental health is such a big stigma. The more you talk about the mental health concerns, the more we can bring in the change in the society, the more we can normalize it. So going back to how people do fear about getting into these um, concerns or looking into, or maybe they just like deny, oh, nothing is wrong, he's just having a bad day, or maybe it's just like a teenage phase that's going on in his life, right? So there is a lot of like fear going to that mental health concern phase, because again, like we are not feeling comfortable going there, and people do fear talking about suicide or mental health concerns.
No, I totally hear you. And coming from a non-therapist background, but like from my personal story, when I have suggested some friends that, why don't you talk to someone? Why don't you see a therapist? It hasn't always been received as a constructive advice. People are scared, like as if there's something. What
Mm,
I've noticed is that people feel there's something wrong with them.
yeah.
I think of a pressure cooker sometimes. Pressure cooker is this device where you cook something and there's like pressure building up. So it's almost like I think they feel the moment they'll be in front of a therapist, the valve will open up or something like that. I don't know what it is, but I have noticed, I have seen this fear. And I think I told you, but what we started doing differently in our workplace was um, when I have a session with my therapist, I don't say that I have a meeting
Mhm.
or I have a prior commitment. I say I have a session with my therapist. And my hope is that by just a small sentence like that, it would allow other people to either seek therapy when they feel that it's okay to do that, or to be able to say that yes, even I have a therapy session, even I'm getting help. Like just be able to talk about it without there being so much weight around talking about therapy. Like it's such a weighty subject for some people. So yeah, this was
Yeah, totally. Yeah, and in a way, Vidushi, you're normalizing again, right? So you're normalizing that therapy is okay. Having emotions is okay. We are humans. Like we do get overwhelmed. We do get anxious, right? We do get those feelings of anxiety. And that's okay to experience those. We are humans. We can make mistakes and we can feel all those feelings,
Hmm.
right? We are not devoid of those things. And so it's a great way to normalize those things, which I think our society needs today.
Yeah.
Yeah, totally.
And you mentioned self harm very briefly. So I'm going to take a very non therapist attempt at defining it. But like a layman, I would say self harm is in some forms that I have heard about or read about it, is in people, for example, might cut themselves because it gives them temporary relief. Because
Mhm.
I think people don't understand self harm as well.
So self harm, I see that as an addiction.
Hmm.
So when somebody harms themselves, um, it's more about releasing their emotional feelings. It's about numbing themselves from the pain that they are experiencing. So what happens is that the emotional pain is so much, it's an overload that they cannot do anything with that, and instantly they want to release it. They want a
Hmm.
quick fix in this moment, and the quick fix is to harm themselves. And when there is a physical cut, they can totally attend to, because it's easier to take care of that physical cut. It's easier to get distracted and take your mind on that physical pain than the emotional pain, because it's so unbearable, so traumatizing, right? So people usually use that as an outlet. And then when they have used that as an outlet for a few times, it kind of gives them relief. It gives them a relief from the pain, from their emotions. Um, they just get into that habit of doing it
Hmm.
again and again, again and again. So it's like coping for them,
Hmm. 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 Hmm.
right?
You're right. And the way you explained it, now it makes sense why you called it an addiction. It's like when people might use substances to numb the pain,
Mm-hmm.
the objective is the same, that I
Mm-hmm.
cannot handle what I'm feeling. Let me feel something else, something physical. And I would imagine that there is a lot of shame associated with the act of self harm.
Oh yeah, like there's so much shame because it leaves scars on the body. I do see a lot of kids and a lot of children and youth who are wearing full sleeves clothes even in summers. They are wearing it for a reason, because they do not want to show their scars, because then people would be like, there's a lot of reaction, a lot of judgment from people,
Hmm.
right? And we do not want that. Nobody wants that. Nobody wants that
Mm,
reaction. Like, oh my God, like what happened to you? What's going on with you? And everybody, like, who is on the street, who they meet in their friend circle, who they meet in their family circle, everybody would be like looking at those cars and would be like, what the heck is going on? What's wrong with you?
mm, mm.
Right. And so mental health and self-harm, like all of these things, they like people are good at hiding these things.
What I was realizing as you were talking through this is, and I know we don't really have a solution, maybe the solution or not the solution, the first step towards solution is to talk about it. But how as a society, our first step is always to judge when someone is different instead of kind of trying to understand that this might be the case because they are hurting. There might be a story that we don't understand. That's not our response. Our first response, like you said, is what the heck is going on here? Like, why are you doing this to
Yeah.
yourself? Versus understanding or even attempting to understand that kind of we are a judgy society.
Totally. That's such a good point, Vidushi. So I don't know if you have heard about Brene Brown.
Mm,
Have you heard of Brene Brown?
vulnerability,
She's
right?
absolutely. She has a great clip if you get a chance to, or maybe you have already seen it. She has a great clip on empathy.
Mm,
And she explains empathy versus sympathy in a very simple and a really like in a very articulate manner. And she says that why we are not able to empathize is because we have to connect with ourselves to that part of ourselves that is so deep down that nobody wants to touch.
mm,
So if I have to actually connect with you, I have to connect something within myself first in order to connect with you. It's easy to sympathize. It's easy to say that, oh, yeah, I'm so sorry that that happened, right? Every time a person is like, oh, I did not get a good grade. Oh, at least you got good grades in the other subjects. We just say at least.
like at least there's something that is a positive silver lining, and I'm going to point your attention to that because it's very uncomfortable for me to sit with you in this pain and in this discomfort, because then I have to address my pain and discomfort, like you said. Wow,
Absolutely.
this is so true.
One thing that I do want to kind of highlight is that when you come across somebody who is struggling with mental health concerns, listen to them. It's a whole different perspective, a whole different thought process that people with mental health concerns um, or struggling with suicidal thoughts that they are going through. So listen, be more empathetic if you can, rather than judging and saying that, oh, you're so selfish, or think about the other people, what will happen to them. It's creating more guilt for the other person when you say these things, and they will shut down even more and they will not tell you anything.
Hmm. That's actually very important, especially the last bit that you said, that if it's not, of course, we're not talking about a situation which requires an expert to be there in the room, but even if it's like conversations about hopelessness, helplessness, not always judging them and being like, I don't know why you behave this way. Like, think about the people who have much less than you do. That's something that I've heard very often. I'm still learning that lesson in my life because I have that voice of the society in my head sometimes, that everything is great. Why am I feeling this way? I don't have a right
We
to feel
all
this
do.
way.
We
Yeah.
all do. Yeah, totally right. And it's so sad denying the existence
Mm,
of our emotions, the existence of humanity in a way, that no, you're not allowed to feel this way.
I really hope that we are able to create a society where, and I think we are in the process of doing that, but where emotions are okay.
They are very valid. They are not fake. They
Hmm.
are there. They are a valid part of you.
Hmm.
And yes, they will not stay the same. They will change.
Hmm.
So meeting the person where they're at rather than putting your own judgments in there. If you get a chance, or if anybody who is listening gets a chance to look at it, it's a really quick 2-minute video. It's called It's Not About the Nail.
It's not about the nail.
Yeah.
Okay.
It's a really cool video to just show us to how we just get into problem solving, and whereas the other person is just looking for validation.
Okay. Yeah.
It's a really cool video and it's a really funny one too. So if you get a chance, it's not about the nail. Go look at it.
I will put a link in the description box as well. If for the
Yeah.
Brené Brown video as well, the one that you talked about, if I can find that clip, and it's not about the nail as well. I do want to thank you again for
Yeah.
taking out time. I know your time is precious with everything that you're doing and all the things on your plate. So I really, really appreciate you sharing your story so vulnerably and then really talking to everybody who might come across this podcast or this YouTube channel.
I'm more than happy to do that. And thank you so much for giving me this opportunity. And I so appreciate all the work that you're doing. I learned so much from your work too. So keep up with the good work.
Thank you. Now I'm blushing a little bit. Thank you so much. So, we are going to wrap up the podcast. Thank you to everyone who was listening. I'll put some resources. I'll consult with Parul as well. Put some resources if you need support that is available digitally. If you are dealing with something where you think you might need a little bit of help when it comes to mental health. And I will also drop the links to the videos that Parul mentioned. So, I hope whoever is listening, you have a nice, healing, warm, snuggly, nurturing day.